Hello and a very warm welcome to the brand new edition of To The Point. I'm Kriti Mishra. And on today's show, we are joined by Environment Secretary, Government of India, Mr. C.K. Mishra, who also heads the Empowered Group on ensuring the availability of hospitals and allied services. Mr. Mishra, thank you for joining us and welcome to Atsava Television. So it's an
Thank you,
honest
Kriti.
task. You're heading one of the panels of the Empowered Groups to ensure availability of hospitals. What is the strategy?
See, the strategy is actually a response to the challenge that we have. And the strategy in a nutshell is that muster all the resources that you have, whether in the government sector, the private sector, or the public sector elsewhere in CPSUs, put them together at a pool, plan at the district level, and get dedicated COVID hospitals in place where the needy can go and seek cure. And
So,
we are planning this in a big way.
so you said you're planning this in a big way. We'd like to understand.
Okay, so what we are looking at really is that given the fact that about 80% of those who are tested positive may not need hospital care. Two levels of hospitalization that we're looking at. One is at the level where oxygen supply would suffice and the patient would get cured. The second level is a higher level where you really need sophisticated ICU equipment or ventilators, etc. The rest of the patient, which is 80% of the lot, would need simple beds to isolate themselves because they would be mostly asymptomatic and they don't really need medical treatment as such. So we are planning these in 3 stages, and we are planning in such a way that depending on the population of the district, in a scenario where we presume that more and more patients will come, so we have done the preparation in that way, keeping a kind of a thumb rule that we need to over prepare. So we have mapped our resources in the district. The resources are now available with us. Some, of course, are being used already because we have patients, COVID or non-COVID both. So we will map all those resources, put it together, and then make this three-tier structure work. Three-tier structure will work with a connectivity. So if at tier 1 you have a problem, you are immediately shifted to the next level and next level to the third level. The experience so far has shown us that majority of the cases, the huge majority of the cases in fact, just need a little oxygen support to come out of this problem. So it is based on the current experience of the last 1 month that we have gathered. We have worked out our strategy of hospitalization so that people can get into hospital and get cured. Our larger strategy is to make sure that people who are vulnerable, age 70 plus, 60 but comorbidity, who are vulnerable and susceptible to this disease, we are able to isolate properly at home and not have let the opportunity arise when we have to get them to the hospital. But let me assure you that any patient who will need any degree of care, whether it is ICU or ventilator, we will be making arrangements for that. And our arrangements will be in place.
So, one of the basic concerns that the world is talking about is about testing, to get into aggressive testing. We also plan to have about 40,000 testing in days to come. How are you coordinating with the private players? How are you coordinating with the states?
Let me begin by saying that testing is a strategy, it's a focused strategy, and need-based test. Indian strategy has worked so far, but we are ramping up every day to face new challenges. Any strategy that you make is a response to a challenge. And the moment the challenge starts changing, your response starts changing. So you respond differently. So what we are doing is trying to double up our efforts every day. If you look at figures, for example, around the 1st of April, we were testing around 5,000 every day. Yesterday, we tested close to 30,000. In fact, more than 30,000. We were looking at a small figure at the 1st of April. Now we are almost reaching 3 lakh patients whom we have tested. But in our entire testing strategy, the percentage of positivity is almost remaining the same, which means for every 100 tests done, the percentage of people who are testing positive is by and large remaining the same. The numbers will obviously increase because there are more people getting tested. Our strategy also depends on what we do in the hotspots and how we test in the cold spots. We need to aggressively test in the hotspots. When we started our testing strategy, we were solely dependent on what is known as RT-PCR strategies. And that was also only the public sector RT-PCR which we were using. So one of the major decisions we took was to get the private sector. We included them. We've empaneled close to 75 of them right now. The second strategy was to further expand the availability of laboratories which test. We were some 120 or something. Today we are close to 257. I think the figure is 254 or something. So every day we are adding new laboratories. Third was, how do we focus and identify the need of the people? And how do we expand the scope of testing? So we started with testing only those who had come from abroad and the contacts. Went on to test more, and now finally we said we will test all SARI cases, we'll test all those hospitalized cases. Now we are at a stage where we are trying to say that we will test every ILI, which is influenza-like symptom, which in now common language means everybody with fever, cough and cold. All three of these combined, put together, we will put to test. We also add additional testing tools. So moving from RT-PCR, we used all the machines that we're using at one time in the National TB program, which is your CBNAT, which is commonly known as the Gene Expert, then your TrueNat machines, your NACO machines, all that. And we've ramped up further by getting all the scientific institutions. We had machines for research. So now we are using it for testing. So we've expanded the base of the people to be tested. We expanded the wherewithals of testing, and now we are backing it up with available kits, etc. And our further strategy is, in selected hotspot areas, we will do what is commonly known as rapid testing, which is an antibody test. That is going to start in a couple of days in selected areas. That is basically a surveillance tool to supplement our RT-PCR testing to say that the results that we are looking at, are they the same or are they different? So this has been our testing strategy. We've been ramping it up. And let me tell you that we will continue to do ramping at the same speed in future as well. We are making every effort to do that.
But Mr. Mishra, that requires massive infrastructure. How are you readying the infrastructure?
Now, most of these infrastructure are in medical colleges, which were not being used for this kind of a testing. With a little modification and addition of manpower, we have now started using them for this. Earlier, ICMR accredited laboratories were very few. We have made other laboratories ready now. It's not that we've ab initio built laboratories. There were existing laboratories which did not have the complete complement of things that makes you test RT-PCR. So we've added those extra items and made them fit enough to do the tests.
Absolutely, we are expanding the existing capacity, and how do we plan to create new ones?
See, the completely new ones will come up slowly. And in the private sector also, they are coming up. And in the government sector, there are newer medical colleges which never did this, but have a, let's say, department of microbiology there which can do this work. So we are trying to create this, bring these medical colleges into the fore. I'll also tell you that we have now identified 14 mentor institutions, which is institutions like AIMS, NIGRINS, JIPMER, and some of the very well-known institutions, CMC Vellore, etc. We've got them together to mentor at least 10 medical colleges each to be able to establish this testing facility. They'll handhold, they'll try and get them the equipment so that these new medical colleges come up as testing hubs for us.
That's a very important point you're making, sir. But talking about the testing kits, how difficult is it to import them right now, and also RNA extractors from different parts of the world? And what is the solution that you've actually designed?
It's a tough task. The availability is low, but we've managed to get enough for our requirement. Today, as I speak, there is no crisis of either RNA extraction kits or VTNs, as we call it, or the kits for testing. Of course, we've not been able to deploy rapid testing so far because we've not had the supplies, but those supplies are also starting from today, so we should be in a comfortable position. Let me tell you that the market and origin of these supplies is limited. And it is not just India which needs it, it's the entire globe which needs it. So these are tough times in terms of bargaining and getting kits. But we are working very hard to ensure that the supplies come into us. And I'm hopeful that we will have them.
You're working very hard. You said we hear reports that these panels are working round the clock.
You think there's any other option? There's a task to be done, and we must do it.
Right, sir. But talking about the exclusive dedicated COVID hospitals that provide comprehensive care to the patients who are suffering severely, what is the plan on that?
See, patients who are suffering severely and cannot be managed on normal oxygen flow have to be shifted to the ICUs and have to be shifted at, as need be on ventilators. The current reading is that the number of people on ventilators is pretty low, given the number of patients. But we are mindful of this and we are trying to organize ourselves in such a way that both the public and private facilities of ICU put together in a district is sufficient to handle that load. It is a tough job because we are a little short on ventilators, etc., which orders have been placed and they are coming. But for the next a month or so, we have made enough arrangements that God forbid if some patient really requires it, we will be able to service it.
But sir, in different parts of the world, we saw something like in South Korea, the cases of coronavirus infection getting relapsed. How big of that a worry that
That
is for you and for the department and the Empowered Group?
that is indeed a story that has come out, and let me tell you that researchers at ICMR have already started working on that. Because see, this entire game plan and action has to be science based. It's knowledge based. It's not just an administrative arrangement. Science dictates what we need to do, and administration will facilitate what needs to be done. So we've got this knowledge now. The ICMR scientists are working on it, on what does it mean for us, and we'll take steps accordingly.
Right, sir. Talking about South Korea, Singapore, these countries have also been at the forefront of fighting against coronavirus. Any specific lesson that India has to learn from these countries?
Uh, One big lesson that India learned and has implemented very well is ensuring lockdown and social distancing. Whichever country has done this very effectively has been successful. And we have examples from the globe. And these are lessons we picked up. And we've another lesson we picked up is that you need to start early. And that is particularly true of the Indian scenario that all the major decisions at the highest leadership were taken early and in time, unlike many other countries where they were delayed and they paid for it. So maybe we'll see the evidence of that.
Absolutely, sir. As you've said that we have learned our lessons and we started early. What is your take on extension of lockdown? Lockdown 2.0.
See, these are decisions which depend on various factors. And the number of patients, the way the disease is growing, the virus is spreading, how the hotspots behave. Actually, if there is one medicine which is very effective, it is isolation and a person staying. So we need to identify, but at the same time, life must go on. There are necessities which must be fulfilled. So it's a combination that is likely to work. And you have seen government has come up with a notification, and from the 20th of April, we are going to ease somewhat because activities must start. But we must be mindful of the fact that all this will only succeed and further improve this relaxation that you're talking about if we are able to clearly maintain that social distancing and are able to keep ourselves to our houses to the extent possible.
So, how are you ensuring that in your ministry?
About discipline. It's about discipline.
Absolutely, sir. It's about discipline. How are you ensuring social distancing in your ministry, doing your ministerial work, doing the work of the empowered group as well?
So we've cut down the number of people together, and we're taking relevant steps like not being too close to each other, ensuring that masks are on when we are talking to each other. Today I don't have a mask because I'm on a virtual conversation with you, but we are ensuring all this. But the critical factor is hygiene. Hygiene of the place, hygiene of the individual. And that is what is going to help us in the long run.
Right, Mr. Mishra, I'd just like to understand what are the challenges that you foresee? The unseen challenges, the unheard challenges that coronavirus has thrown up.
Challenges are many. For a country with the population of India, it's a huge challenge. The biggest challenge right now that we have before us is to contain. And our biggest intervention right now is the containment policy. We have areas which are completely free. We need to keep them free. We have areas which are, I mean, a high number of caseload is there. We need to do very strict intervention and strong intervention in that area to ensure those cases go off and don't spread any further. So containment is the key.
And lastly, Mr. Mishra, any specific strategy for the hotspots?
I would say we need to ensure in the hotspots that people stay indoors, cut transmission to the maximum. Those who are infected, test, treat, and cure, and ensure that they don't spread it to anyone else by complete social distancing and keeping indoors.
Right, sir. So the biggest takeaway that we have from this interview is test, treat, and cure. On that note, Mr. Mishra, thank you so much for joining us and giving us those valuable inputs.